Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us. Our guest is Dr. Mike Ybarra, board-certified emergency physician and also vice president of medical affairs and strategic alliances at PhRMA. And he's joining us on the program to talk about a new national series called Together. This series features patients and industry scientists who are behind development of treatments and cures for some very complex and very devastating conditions. Welcome to the program, Dr. Ybarra. How are you?
Good. Thank you for having me.
Now, we've been talking in a series here about some conditions that PhRMA is involved in, juvenile rheumatoid arthritis to be one of them. Give us a bit about your background and your role there at PhRMA.
Absolutely. Well, as you mentioned in my intro, I'm an emergency physician, and I work clinically in one of the local emergency departments here in the district. I do that once a week. But I'm really fortunate to both practice medicine and also do advocacy and public policy work. And it's really exciting for me to talk about the Together campaign because in the campaign, we're pairing patients with researchers, and working in the public policy arena really allows me to make sure that the great work that the scientists and providers are doing is maximized for the benefit of every patient across the country.
Now, are we talking about a certain type of condition, a certain class, or are we talking about any condition that may be, maybe underrepresented in awareness or maybe funding or research?
So each of the pairings in this campaign, the Together campaign, it brings a patient and a researcher together. And these are real life individuals. The researchers have spent years of their life at the bench working on molecules that will hopefully help the patient. And the patient has the disease. And what the campaign does is really try to show everyone what we see, those of us that work every day in the biopharmaceutical industry, is to kind of show everyone what we see, which is we see those researchers that are working really hard to bring those new treatments to patients. And it's for some of the most important diseases that we're facing right now. Every disease is clearly critical, but there are a number of areas of unmet medical need. This campaign is looking at things like multiple sclerosis, migraine, lupus, epilepsy, and it's also talking about new breakthrough treatments for in cancer, such as CAR T therapy. So this is a really large effort. It's a national effort, and it's really looking across a range of diseases.
Now, you mentioned that you were fortunate enough to be working in advocacy and practicing medicine. Why did you start in advocacy?
Well, it was really I'm very lucky to be able to do both. And I really, taking care of patients is one of the greatest things that I feel like I can do. But I also feel like working in public policy allows you to think at a little bit of a higher level and look at policies, look at things that policymakers can do to continue to spur the innovation that I think patients really need. When I'm taking care of patients clinically, obviously we're always looking for what the best treatment is available to them. Mm-hmm. And sometimes there are areas where there's just unmet medical need, and being able to see that and then also think about ways we can advance public policy that could address some of that. That to me is a really important, both of them are really important, and it's a good balance.
What about some of the challenges that you face in the Together campaign in trying to get some of those advancements on board?
Certainly. Well, one of the good things is that we're in this new era of medicine. Medicine has changed dramatically in the last 10 years. There have been so many advances and new medicines that are being brought to market for the betterment of patients. And I think of immune therapy. That was, I believe, in 2016, the American Society of Clinical Oncology named that the breakthrough of the year. There are many times that, there are many new treatments that are coming to market. But I think the campaign also, wants to highlight that not every treatment works for every patient. That's why we need to continue to innovate and to continue to do this research. And one of the examples of this was in the CAR T pairing. There was a patient that relapsed for their cancer treatment despite having every available treatment. It was ultimately this immunotherapy that saved his life.
So is immunotherapy, I guess, the forefront as far as research and development is concerned that you're involved in?
So a number of our member companies are very much spending a great deal of their research and development time looking at new treatments for cancer. And immunotherapy is an exciting new frontier. It's been something that scientists have talked about for decades, and yet it's really only been in the last 5 years that we've been able to bring treatments to patients. And it's showing great approval for a number of types of cancers. But a lot more research needs to be done because, as I think you and your listeners realize, cancer is such has such a large impact, and there are so many different types of cancers. And the more we learn, the more complicated it gets. We used to just talk about blood cancers, and then a decade later we learned about leukemia and lymphoma, and then a decade later we learned about the various different types of leukemia and lymphoma. So we're really, we're peeling away the layers of the onion in terms of understanding how complicated cancer is, which I think gets back to the point of we need to continuously innovate to find new treatments for patients.
Where can our listeners go online and get some more information about the Pharmaceutical Research and Manufacturers of America?
Well, I would really encourage everyone to take a look at innovation.org. That is a landing page that we created to show the pairings of the researchers and the patients, and I think it has a number of great resources where folks can learn more about this campaign.
Thank you, Dr. Ybarra. It's been a pleasure talking with you today. I'm hoping that I can get some updates in the future.
Yes, and thank you very much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of the program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page when you visit us at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.